The following content is for entertainment and educational purposes only. It does not constitute means for diagnosis, healthcare advice, nor treatment. Make use of a qualified healthcare professional for such purposes.
So we're talking an awful lot about the negative factors, right? The negative factors of stress. But what can actually mitigate, right? Can actually mitigate aspects of stress. So what are the aspects that can mitigate stress? The first one is a social support, right? Social support. Sometimes I feel like people confuse social support with enabling, and that's not a good social support, right? What I mean by social support is someone who is going to provide that emotional sustenance, right? That emotional substance that could come from your network. So for example, your peers, your friends, your neighbors, persons from a church or a synagogue or a mosque. So notice that people who are in your social circle. Notice that this has been scientifically studied, right? So it's not guesswork. As you know, psychology is not in the business of guesswork, it's in the business of predicting behavior. So we need some sort of statistics to substantiate these claims. Notice that the favorable effects of a social support can be strong enough to reduce the chances of you dying by 50%, right? So if you have a support system that can allow you to reduce stress, remember that you are at a higher risk because of personality factors, because of coping mechanisms. But if you have social support, we can decrease those chances by roughly 50%. Notice that the type of support system that you're going to prefer generally depends on your culture, right? Generally depends on your culture. So some cultures will prefer a really small circle. Some cultures would prefer a really large circle. Some cultures will prefer, okay, just family or just friends. For us, in America, we tend to lean more towards friends. And in other cultures, we tend to lean more towards family when it comes to our support system. But notice that here, particularly in American culture, we prefer the explicit social support, right? Explicit social support, and not necessarily something that is not overt. And what do I mean by that? We like to feel supported. We like to feel loved, and I want to know that you love me and you care about me, right? So for some people, I do have a client, he talks a lot about the love languages, right? He mentions that a whole lot. So notice that in regards to our social support, we may prefer other instances of support. So for example, think of individuals who may be of Asian descent. Notice that in this particular aspect, what we are looking into in regards of an Asian population is implicit social support. So not necessarily that overt social support, but implicit. Notice that in this particular case, it's not love me, I love you, let me know that you love me. But in some cultures, it's more like, I know I have someone to count on should I be stressed. All right, so that would be more of the implicit factor. What is another factor that moderates stress? What's another factor that moderates stress? Optimism. Optimism is a factor that will moderate stress because this individual is going to have a tendency to expect a possible good outcome. Notice that earlier in previous lectures, we did talk about the big 5 personality traits. Notice that an individual who is conscious, right? A person who has a lot of conscientiousness, notice that an individual who has high levels of conscientiousness generally will have good physical health. Not only that, their life expectancy will also increase. Notice that an individual who has this type of personality, notice that in this particular case, that person is less likely to have unhealthy habits. So for example, smoking or utilizing drugs. Notice that social class is also an aspect that moderates stress, right? So for example, having a low wage, being in a house or housing conditions that is crowded because unfortunately you can't afford a better living, and pre-existing medical conditions. This is really interesting and a lot of people forget about that. So think about, for example, imagine that there is this business, right? And you are the recently hired engineer, right? Fresh out of school with your bachelor's, you're the recently hired engineer. And then there's the CEO of the company, right? Maybe he has a Ph.D. in engineering, right? So in this particular case, you are more likely to have stress than the CEO. You are more likely to suffer from a heart attack than that CEO. Why is that? Well, it's not because necessarily he's less stressed out than you, right? It's not necessarily because of that, but because of your lower social class. Because of that reason, your rewards are seen as less. Maybe your work, you're not seeing your work as rewarding as perhaps the person who's the CEO. That increases the levels of having a heart attack, right? So you're this recently hired engineer, fresh out of school, entry-level job, whereas this person, maybe they've been practicing for 20 years in the field of engineering. So notice that it's not necessarily because they have more stress than you, but because they see it as more rewarding, right? It's more rewarding to most people who view being the CEO of a company as more rewarding than having an entry-level job as an engineer. So the chances are that you indeed will be at more risk when it comes to an illness, a heart illness. Something that I like to mention is resilience, because there are positive effects of stress. That is resilience. Notice that you can have personal growth because of stress, right? Because of stress. I like to think that I manage stress really well. I don't know any other way I could have graduated if I didn't know how to manage stress correctly. Notice that that has allowed me for personal growth. The stressor of going to school has allowed me for personal growth and self-improvement. And why is that? Because now I have the opportunity to teach young people what I know. I have the opportunity to work with clients and patients under supervision. So notice that it has provided me an aspect of growth. So yes, getting a PhD was stressful, but nonetheless, it allowed me for personal growth. Notice that stress, as I mentioned in our previous lecture, it lights a fire. It allows you to work and adapt to your circumstances. So because you are adapting to this new circumstance, right? So for example, when you graduated high school and started this course, notice that now you're going to have personal changes. You're going to learn how to manage your time better, right? Because it's a little bit different than high school. It's going to allow you to perhaps manage your time better and things of that nature that could help you for better personal changes. Not only that, dealing with stress now allows you to face future stress, right? This is something you will see in practice a whole lot, because something that I like to ask my own clients is, what has helped you before? I mean, some of them will say drugs and alcohol, and I mean, to be fair, if it helped them, I mean, it helped them. Is it perhaps the best method? Perhaps not. But because now I know what has helped them in the past, if it was a good coping mechanism, now we can use it today, right? How they say it in the South, if it ain't broke, don't fix it. Well, if I know that that coping mechanism has helped you in the past, let's keep utilizing it for future stressors. Let's talk about what can limit your health. What can limit your health? We talked about aspects that can mitigate stress. Let's talk about aspects that could contribute to stress. One of them is smoking. Individuals who smoke tend to have a shorter life expectancy. Generally, an individual who smokes may live around 10 years less. So is people with depression, by the way, anywhere between 8 and 10 years. If you have depression, you're less likely to live longer, by the way. Fun little fact or sad little fact. I don't know how to word it. I'll leave that to you, right? Individuals who have depression tend to live less. Notice that one of the aspects that could be detrimental, I should say, is tobacco-related diseases. So for example, cancer, right? Cancer could be one of those factors that are perhaps at risk because of the behavior of smoking. Notice that the higher the education, the less likely an individual is to smoke, right? Because I would argue, I would like to say it's because they're too busy with school, but that's not it. That's not it. And generally individuals who have higher education tend to smoke less. Another risk factor for stress is lack of exercise. Of course, lack of exercise is indeed linked to poor health. As you know, there are extensive benefits for exercise. Notice that in regards to stress, we know that stress increases the chances of you developing a heart condition. But notice that by exercising, right, you are engaging, you're helping your blood flow, right? You're engaging in the cardiovascular fitness. Notice that another risk factor for heart disease is, of course, obesity. But while you exercise, you're going to decrease the chances of developing heart problems or conditions that could be related to heart problems. So, for example, obesity. If you recall from earlier, inflammation can lead to heart disorders, but because you are exercising, it's going to be minimized, that risk of inflammation, right? That risk of inflammation. Notice that in regards to your brain, it's going to reduce the chances of your brain shrinking. Your brain will shrink, by the way, just letting you know. You didn't know that, I'm telling you right now, your brain will shrink. By the time you're 90, I forgot how much the percentage is, but your brain will shrink, right? It's a natural response of aging, right? But you can reduce the chances of that occurring, I should say, through exercise, right? Through exercise, reading, there's a lot of things that you could do to reduce the chances of your brain shrinking. I believe it starts in your 30s, actually. So basically, you got a short run, that's what I'm trying to say. You got a really short run before your brain starts shrinking. But don't quote me on that. I think it's a little older. I don't think it's in your 30s. I think it's a little older. All right.